Go. Good morning, good afternoon, good evening. It's an astounding pleasure to be here today to launch the first Emirati Environmental Explorer Optimism and Sustainability discussions. For those that aren't aware, EEE or Emirati Environmental Explorer is really a mechanism that looks to explore topics around sustainability in the UAE and beyond. And today we are joined with a very special guest, Mariam Wazan, a health and digital sustainability expert. Mariam, thanks for taking the time to join today. I guess just to kick us off on this discussion, what do we mean when we say sustainability in healthcare, and why should we think about these things?
Okay, so first, hi, good morning. So basically, when we talk about healthcare being sustainable, what we mean is delivering the best care you can to current patients and meeting their needs, but at the same time not impacting the health of future generations while doing so.
And when you talk about finding that balance between present and future, is that something that's inherent within the healthcare space?
Not particularly, because there's always a concern about compromising the quality of care that you're delivering to patients while also protecting future generations. Yeah.
And what does that mean in practice, in reality? What is that? What does the implementation look like?
Okay, so you can think of it in terms of 3 different levels. So before actually needing to access your healthcare facility, and then when you're trying to access your healthcare facility or you're trying to get the care that you need, and then the last step would be when you are in a healthcare facility, right? So for the first kind of level of healthcare sustainability, you can call it sustainable prevention, which is empowering people to take control of their health and their well-being, reducing the risks, reducing the probability of them having certain diseases, helping them gain awareness of lifestyle changes that can be made, encouraging regular screenings, encouraging people to follow established healthcare plans that they have, so that they need to access facilities less altogether. And then the second level you can kind of think of is called, you can think of it as a sustainable pathway, having a sustainable pathway, which is basically improving access to healthcare, right? So here you can think of digital health, for example, right? Which makes it a lot easier for patients to be able to access their doctor, and also reduces the environmental footprint by decreasing the need to travel physically to a healthcare facility. And what an example of that in practice would be, for example, with digital triage. So for example, telephone advice, patients receiving telephone advice for certain issues, or even online symptom checkers that have been developed. So all of these kind of reduce the need for a patient to physically access a healthcare facility. And then the kind of last level you can think of it as sustainable practice. And that's once you're in a facility, it's reducing the carbon footprint of the care being delivered. So that's creating products that reduce waste. So creating products that reduce waste, and it's thinking of the waste in the actual process of developing. So reducing the amount of items we use in a healthcare facility, changing the type of items that we use in healthcare facilities. But this is where it gets tricky, because when doing so, you don't want to compromise the quality of the care patients are receiving. This can also have an impact on reducing healthcare spending, which could make healthcare more accessible, and kind of links back to the point above about sustainable pathways, specifically in governments where a large portion of the GDP goes towards healthcare. Reducing spending would improve access to healthcare, because more people would be able to access it.
That's really helpful, Mariam. Thanks. And I like the three levels that you described, and particularly the tension between sustainability and optimal healthcare practices. I guess, hearing what you've said, the question that then comes into my mind is, why is that important? And what are your thoughts on possible interventions or engagements in that space?
So it's all kind of linked. So if you go again, and we look at it in terms of the three levels, if you're not taking care of your health, you're more likely to need to use up more healthcare. So you're more likely to need to travel more to healthcare facilities. And then once you're in the facility, you're more likely to need to get more tests done, you're using up more supplies, again, increasing the cost of, depends on country that you live in and how the healthcare system is set up, but basically more spending on healthcare is taking place. So they're all kind of linked, and that's why it's important to try to work on it from the beginning, from prevention to kind of then it'll trickle down.
Yeah, that pre-intervention versus the post-intervention timeline. I guess not a lot of us are health experts like yourself. Sustainability is a key theme and topic. I guess one question, and maybe to kind of end, what is in the healthcare space something to give you optimism with a sustainability lens? What should we be looking forward to? How can we promote optimism within the space?
You can see a lot more people being aware of their health and trying to live a more healthy lifestyle, whether that's in terms of the food that they eat, whether that's in terms of exercising more. There's just generally more awareness towards health. Also, I think people are more comfortable accessing digital health services post-COVID in comparison to pre-COVID. So that's also a change. I think that COVID almost helped to accelerate the adoption of digital health in a way.
Yeah.
So you can see behavioral changes, which is great.
Yeah, I think that behavior change is such an underestimated lever that is getting more and more attention and traction. Great. I mean, I've learned a lot in this discussion. I think, the nexus of sustainability and healthcare is one you touched upon really well, what it means in practice and those three levels that you described, but also why it's important. And I think, the main takeaway message that I've heard from you today is really that behavioral change is key in healthcare and in sustainability. And I think being aware, looking at practices that are important, I think is integral. And so I think with that, Mariam Wazan, I want to thank you for taking the time to join us, share your expertise, and thanks again for being the first EEE podcast or discussion participant with us. Thank you so much.
Thank you so much.
Bye. Bye. Bye.
Bye.